A Medicare Advantage broker can legally pocket over $1,300 for signing you up, and you would never know a single dollar changed hands. You pay zero in extra premium, and yet a four-figure payment rides on which plan you choose. I read the fine print so you don't have to, and this one is buried deep. Every year, millions of newly eligible seniors pick a Medicare plan without knowing what their broker earns to steer them. Across the country, brokers now collect around $10 billion a year. Today, I'll show you 3 moves: verify how your broker can be paid, compare Advantage against Medigap, and demand bonus disclosure in writing. Here's the number that should stop you cold. Payments to Medicare Advantage brokers hit roughly $10 billion in 2022, according to a Brown University study, more than double the $3.9 billion paid in 2014. But here's the part nobody tells you: that money doesn't reward better advice, it rewards steering you into Advantage. 3 moves to see the money behind the sales pitch: verify the pay, compare the incentives, and get the bonuses in writing. Medicare Advantage brokers are paid directly by the insurer, never by you. The commission is baked into the plan's economics. CMS, the federal agency that runs Medicare, sets a maximum fair market value commission each year, split into an initial payment and a smaller renewal. Advantage commissions are simply set far higher than Medigap, which makes it the high-pay product to sell. Look at the gap in dollars. For 2026, a broker can earn up to $694, placing you in an Advantage plan, per CMS Fair Market Value guidance. For a comparable Medigap policy, the Commonwealth Fund found first-year pay is about $322, roughly 20% of a $1,660 premium. That's about double for the same client. Now the second layer, the money that sits outside the visible cap. On top of the capped commission, Axios reported in 2023 that insurers pay brokers add-on bonuses, referral payments, marketing reimbursements, and perks for steering volume into specific plans. These extras aren't itemized to you. They show up in broker contracts as overrides and production bonuses. Here's the cost of not asking. In the 2024 plan year, CMS capped new Advantage commissions at $611, per Axios reporting. That's the number a broker will quote you. But bonuses and perks can push total compensation past $1,300 per enrollee. That's more than double the cap, on a plan you were told costs you nothing. The myth? Brokers earn the same no matter which Medicare plan they put you in, so their advice must be neutral. The fact, from CMS caps and Commonwealth Fund analysis, Advantage commissions run roughly double Medigap. And in states like California and New Jersey, initial pay can reach $780. Put both problems together. Over 20 years, choosing Advantage over Medigap can hand your broker about $3,800 more in commissions alone, modeled from CMS 2026 caps and Commonwealth Fund data. Add the bonuses Axios documented, and total pay per enrollee can top $1,300 up front. None of it on your bill. Meet Linda. She's 68, a retired nurse living on about $32,000 a year from Social Security and a small pension. She's newly eligible for Medicare, weighing a zero premium Advantage PPO, marketed as all-in-one against traditional Medicare plus Medigap. Here's what Linda found. Discovery 1, $694. That's the 20 and 26 national maximum her broker can earn just to enroll her in Advantage, per CMS Fair Market Value guidance, plus up to $347 every year she stays. A Medigap policy would pay her broker about $322 the first year and $166 after, according to the Commonwealth Fund. Yet she was told all plans pay about the same. Discovery 2, the hidden extras. Linda read Axios reporting that in 2024, the commission cap was $611, but bonuses and perks can push total broker pay past $1,300 per enrollee. That means her broker could earn more than double the visible limit from signing her up, while she pays zero extra premium and never sees a dime of it disclosed. Discovery 3, the most unsettling. Linda found the Brown University study showing broker payments climbed from $3.9 billion in 2014 to about $10 billion by 2022, a $6.1 billion surge. Divide even part of that across the seniors being steered each year, and you're looking at thousands of dollars of incentive money attached to choices like hers. Money that shapes plan design, not care. For Linda specifically, the 20-year math is stark. If she picks Advantage and stays, her broker could collect around $7,300 over 2 decades versus roughly $3,500 on Medigap, a difference of about $3,800, modeled from CMS 2026 caps and Commonwealth Fund figures. That's the pull working against a neutral recommendation. So could this be you? You've never once asked how your broker gets paid on your plan. You don't actually know whether Medigap was even offered to you. And you chose your plan mostly because it advertised a $0 premium. If any of those ring true, the next 3 moves are exactly for you. These 3 moves take under 20 minutes each, and every one of them is free. They're worth doing because they turn a sales pitch into a transparent transaction. You'll see the real commission, the real gap against Medigap, and any bonus your broker would rather not mention, do them before you sign anything. Move 1, and I'm leading with this because it reframes every conversation you'll have. Map the commission gap between Advantage and Medigap for your own situation. Pull the Commonwealth Fund's Medigap figures. About 20% of a $1,660 premium in year 1, alongside the CMS Advantage fair market value numbers, and see the difference for yourself. Look up the Medigap premium and its 20 and 10% commissions. Find the current Advantage maximum, $694 initial, $347 renewal for 2026. Then do the 5-year math on paper. Good looks like knowing the gap to within $100 before you decide. Move 2. Verify how your broker can legally be paid. Go straight to cms.gov and find the official agent broker compensation page, then the fair market value table for your plan year. Write down the exact initial and renewal caps and compare them to whatever your broker tells you about how they earn their money. Search CMS Agent Broker Compensation and open the cms.gov page. Find the latest fair market value table for your plan year. Write down the initial and renewal caps, then ask your broker directly. Good looks like your broker confirming their pay is at or under the CMS cap. Before I get to the last move, which is the most counterintuitive part of all this, because it puts the burden of proof back on the person selling to you. Here it is. Ask your broker, in writing, to disclose every bonus, override, and perk they'd receive if you enroll. Then cross-check it against the $1,300 total pay reporting. Email your broker. Describe all compensation you or your agency get if I enroll in this plan. Cross-reference their answer with the reporting that total pay can exceed $1,300. If they're vague or evasive, use a different broker. If breakdowns like this help, subscribe. The next one's already coming. Why act now? In 2014, broker payments totaled about $3.9 billion, per the Brown University study. By 2022, CMS had clarified caps around $573 for initial Advantage sales, while Medigap sat near $322, per the Commonwealth Fund. And in 2025, CMS proposed capping total pay at $632 per enrollee to rein in the extras. The rules are tightening right now. After you act, here's how to know it worked. You should have a written commission range from your broker in hand. Confirm those numbers match the CMS fair market value table for the year. And if any bonuses aren't disclosed, treat that silence as a red flag worth walking away from. Everything here comes from CMS, the Commonwealth Fund, a Brown University study, and Axios reporting. All the links are below, so you can check the exact figures yourself before you enroll. You now know how a broker can earn over $1,300 off your enrollment and the 3 moves that expose it. Next, I'm covering the prior authorization trap that makes those 0 premium Advantage plans cost you when you actually get sick. That prior authorization breakdown is the one that surprises people most, because it hits exactly when you're least able to fight it. If you want to catch that, subscribe now so you don't miss it.